Welcome back. Flu season in full swing, and doctors are seeing a rise in respiratory viruses. Rush Hospital even bringing back those mask requirements. EMS Medical Director Dr. Nick Cozy joins us to talk about the change. Thank you so much for being with us this morning, Doctor.
Good morning, Michelle. Thank you for the opportunity.
Well, let's start out talking about that triple-demic of COVID, flu, and RSV cases. What have you been experiencing in the emergency room so far?
It's a great question. We are seeing uprising RSV, COVID, and influenza cases as we get out of the holiday season. All of our family members have been all over the country, and we're bringing those illnesses back into the city of Chicago. With our migrant surge reaching 30,000, we're seeing increased rates of COVID, RSV, and flu cases.
So with that in mind, as I mentioned, that mask requirement or recommendation coming back in some public health spaces. What do you think about people wearing masks in all public places? Do you recommend that?
I think it's an important decision that people have to make based on their own situation and their own past medical history. As we think about how our flu cases and our COVID cases are increasing, Rush took a proactive stance, along with a lot of other hospitals in the Chicago region, to protect our staff, protect our community, and protect our patients. Now, I will say, what we are seeing, it is prudent if you're in a highly congregated area to consider wearing a mask. You don't have to have something fancy. A regular old hospital mask will suffice.
And of course, it can be pretty tough to distinguish between COVID, flu, and RSV. What are some of the signs that you can give us that can help people be able to tell if someone may have the flu or may have COVID?
It's very hard to determine. A lot of times we do a viral swab, which is a swab up someone's nose to determine what specific virus they might have, but they all look very similar. They have a cough, they have a cold, they have a runny nose, they might have GI symptoms, bellyache, they might have nausea and vomiting. I myself got over the flu last week, which you can hear in my voice, but we're working strong and we're getting better every day.
And before we let you go, what do you think people need to look for as an indication that maybe it's more serious and they may need to go to the hospital?
That's a great question, Michelle. The most important point that I could talk about for you and your listeners is flu is very common. However, for people who have pre-existing conditions, we're talking about those with asthma, those with COPD. If you're having difficulty breathing and you feel like you can't get a good amount of air in and out, that's an indication to report to the emergency department or call 911. Those are the patients that we're seeing that need admission to the hospital and need to be put on oxygen.
All right, important information. Dr. Nick Cozy, again, thanks so much for talking to us this morning.
Thanks, Michelle.